gnawing, stabbing, debilitating, just a few of the words used to describe the painful symptoms of roughly 176 million women suffering with endometriosis worldwide. Actress Kate Bond of CBS's MacGyver is one of them.
I'm Kate Bond. You might know me from CBS's MacGyver.
Yeah, Jack. What cause? And what's safe? What is Riley's dad doing here? And what the hell is going on?
What she said.
I need help breaking into Maddie Weber's personal safe.
I've had painful menstrual cycles for my whole life. I would have really bad cramps, almost like a gut punch. It like knocks the breath out of me. It's gotten progressively much worse as I've gotten older. On my first day of my period, the pain will hit me so hard that I'll faint. It got to a point where sometimes I'm stuck in bed for 4 days. I was taking like 6 Advil at a time just so that I could function. It was affecting every aspect of my life. And people just don't take it seriously. When you say you have cramps, there's just sort of this thing of like, okay, sweetie, I'm treated like an old-timey lady who gets the vapors. I knew something was wrong, and I believed it was endometriosis because I have a family history of it. But over the years, I went to doctor after doctor after doctor, and they all told me that I may have endometriosis, but it was a lot of trouble to diagnose, so I should just deal with it. There was never any discussion that there could be treatment for it. They didn't seem to understand that what I wanted was to not have constant debilitating pain. I was in so much pain, and I had gone to so many doctors that I really had just lost hope.
As she said, Kate was starting to lose hope. That is until she met with OB-GYN Dr. Aliabadi, who finally formally diagnosed her with endometriosis. They both join us now. And I'm curious for you, after all those years, what was it like to finally have your diagnosis?
It goes so much further than relief. I feel validated because for years I was telling doctors my symptoms. I was telling doctors my diagnosis, and I was being told that it wasn't that big a deal. I was being told that it wasn't a problem. When I was 24, a doctor said, well, you know, if you don't want to have the pain anymore, you should just get pregnant.
That's a shame, if I may. That's really unfortunate.
Yeah.
That's a black eye on medicine. So I'm sorry you went through that.
Yeah.
So let's fast forward to then you're with Dr. Aliabadi, and how are you doing now?
I'm doing pretty well. I just had my surgery 2 weeks ago, but my post-surgical pain wasn't as bad as my menstrual cramps.
Wow. So with endometriosis, it's a condition where the lining that's typically inside of your uterus gets outside of your uterus, but that tissue continues to act normally. So just like the tissue is breaking down and bleeding through your vagina through your menstrual period, the tissue that's outside of your uterus is also breaking down and bleeding. So as you can imagine, these women can have a significant amount of pain due to inflammation and irritation and adhesions. And Dr. Aliabadi, we know that there are different stages of endometriosis. Some women just have mild endometriosis, meaning they just have a little bit, but Kate's case was severe, correct?
She has pretty severe and aggressive disease, which has caused her actually to have partial bowel obstruction, which is extremely rare. I see endometriosis patients all the time, and I've done a lot of laparoscopic surgery on them. It's not common to see what I found inside when I was doing the laparoscopy. I was emotional when I was operating on her because no woman should go through this. Her partial bowel obstruction, you know, endometriosis causes adhesions. So most of the time we see those adhesions inside the pelvis with the uterus and tubes getting stuck to the bowel. In her case, her tubes actually look fine and the uterus is fine. She has endometriosis implants everywhere, but she has severe small bowel adhesions and partial obstruction, which explains a lot of her symptoms, you know, bloating symptoms and
GI symptoms, yeah, because depending on what's impacted, that can kind of determine what symptoms you will have. So if you have bowel symptoms, then there may be some endometriosis there. Or if you're having bladder symptoms, there may be some endometriosis there.
I am so glad that you're feeling better, because that does provide hope.